Thank you for joining us as we continue our Eyewitness News special report, Ebola, Understanding the Epidemic. The aim of this program is to educate the public and allay fears regarding this disease. We now head back to our interview with Chief Dr. Patrick Akpaka as we discuss how you can protect yourself and reduce your risk of contracting the disease. Doctors and so on would be able to equip themselves with a certain protective equipment. However, what about the layman on the street? How can we protect ourselves from Ebola? How can we avoid contracting this disease?
That question is very interesting, but first and foremost, there has to be a detection of somebody who has Ebola. And then if that person is detected in any way we can by screening the person with the clinical symptoms and the effects, the bleeding and all that, then we have to avoid that person. Even if in our home where people have been infected, to make sure that that place is sterilized, disinfected before. If I burn and destroy anything that person had used. If it is a floor, you mop it with bleach, because that will kill the virus. Okay? You wash your hands, or you don't use bare hands to handle such people or the materials that they have worn. So education is very important.
What should someone do if they suspect they have Ebola?
Now, you cannot suspect you have Ebola if you never came in contact with a person who had Ebola. One, you cannot say you have Ebola if you never went to the places where there's an outbreak and all that. But if one, because that's what we call the primary case and the secondary case, if you went to places that are endemic or places that have the outbreak, you are at risk if you visited those areas. And then anybody who visited those areas and now has infection and comes to another area, now any person coming in contact with them and getting infected is a secondary case. So if that is the scenario, okay, of course, if there's a breach by your personal hygiene that you never took precaution in coming in contact with the fluid, infected fluid from this person, what you need to do, which is very simple, is to take your temperature on a regular basis, morning and night, to see whether it is rising or whether it is normal. Because that is the one indication, because the temperature will rise above normal, up to 38 or 39. So anytime that is happening, and then coupled with the other symptoms, which I've already mentioned, the cough or the sore throat, the weakness, the loss of appetite, then you'll definitely know that you're coming down with it. And then you will now need to remove yourself from other people. You will need to seek medical help.
What is the likelihood, or how much at risk is Trinidad and Tobago of actually having an Ebola diagnosis here in our country?
We are at risk because of international travel, all right? But if we know what to do and we're doing what we are supposed to do, then, we'll be forewarned and then we'll be prepared or forearmed, So we are at risk, not because we are engaging in the practices, but we are at risk because of the travels.
You brought up a very good point here. Would closing our borders help, or would, by implementing, because other countries have implemented a ban on travelers from certain countries in West Africa, would that help?
Some countries are doing that in Africa, but I think that is a little bit myopic. They are closing their borders because they don't have the facilities for screening. They don't have the facilities for detecting. They don't have the facilities for quarantine or isolation. Okay, that would be taking the bull by the horns. Okay, now, but if we have single ports of entry, either the seaport or the airport, and then we are there to man it, you know, making sure that whoever comes in is screened. Then, I mean, there and then, you know, it will be dealt with.
And most importantly, is there cause for panic?
No, no. Once our people are well informed, you know, because to be forewarned is to be forearmed. Once our people are well informed, well educated, then there's no need. You know, there's no need.
Now, I also spoke to Dr. Akpaka about the measures that should be implemented to reduce the risk of Trinidad and Tobago registering a case of Ebola. Just to emphasize, the only way a case can arise in TNT is if an infected person travels to our country. The best approach, he states, is to firstly have mandatory screening at all our points of entry. This involves taking the temperature of persons entering our country using clinical infrared thermometers. If the person registers a higher than normal temperature, then the person should be pulled aside for questioning. If it is determined that they could have the disease, then a blood test can be given to confirm the diagnosis and the person is sent to quarantine for treatment. He also emphasized that screening, coupled with the proper resources and education, is our best defense. In addition, it is important that you get information concerning Ebola from reputable sources only. This includes reports from the CDC, also known as the Centers for Disease Control, the World Health Organization, and the Ministry of Health. There is a lot of misinformation being spread, which can only lead to chaos. Please do not believe everything you read or view on the internet regarding this disease. I'm Selena Ali. Thank you for watching.